Good day everyone, I am Loie J. Strada from MSU Basin 1 and today I am going to perform collecting a urine specimen or clean catch or midstream. So, a clean catch urine specimen is one that exclusively captures uncontaminated pee. So, in most situations, this pertains to urine caught solely during the midst of urinating. It is also known as a midstream test. So, the purpose of this is to prevent bacteria from the skin of the penis or vagina from contaminating the urine specimen. So, considerations before, during, and after the procedure. So, before the procedure, you must guarantee that all the necessary equipment is available, then maintain a level of privacy, then ensure that water or an alcohol-based rub is accessible. So during the procedure, always remember the proper body mechanics to prevent overstretching or body straining, and make sure to do so. So, follow the necessary standard correct procedure in doing so. So, if the patient can perform the task without assistance, leave the container at bedside and let the patient collect specimen. Then after the procedure, you must document the result. So things to document after the procedure. So assessment procedure done or performed and the result of the assessment. So first, bring necessary equipment to the bedside. So this conserves time and energy. So the equipment to be used are the clean or sterile cup. Then we have here this one. And then we have also the personal protective equipment. So we have it here, the laboratory gown, the face shield, the face mask, and the gloves. Okay, then we have also to consider the label and of course the pen and the documentation record. We have it here. And here, the label. Then, perform hand hygiene and put on PPE or personal protective equipment. So this prevents the transmission of microorganisms. Okay. Then we have to put on the mask. And then the face shield. Then I am going to close the door to provide patients privacy and of course to protect the client. Okay, so now I am going to introduce myself to my patient and verify his identity and of course explain to him the procedure that I am allowed to do. Okay, good morning sir. I am Loie J. Strada, your student nurse for today. May I see your wristband please? Okay, please state your complete name. And your birthday, please? Okay. Okay, so today I'm going to collect a urine specimen. Is it okay with you? Okay. Please relax. Okay. So I am going now to start the procedure. Okay, so for female, I am going to separate the labia and clean the urethral meatus from front to back using a new wipe for each stroke. And also for male, I am going to clean the tip of the penis, wiping in a circular motion, of course, and away from the urethra. So this is to prevent the cross-contamination of the different areas. Okay. Please relax, sir. Okay, so I am going now to wash. Okay. Then I am going to throw this on a spectacle and get another clothes or washcloth. Okay. So now I am going to instruct the client to keep the labia open and start voiding, and then I am going to pause. So the bacteria in the distal urethra and after urinary meatus are cleared, and by the first few millimeters of urine expelled. Okay? Okay, ma'am, are you feeling okay? Okay, thank you. Then, when the cup is half full, I am going to ask the client to pause urinating and remove the container. This is for the cup not to fill. Okay? Okay, ma'am, please urinate. Okay, stop. Okay, that's good. I am going to wipe again the area. Okay. Okay, are you feeling okay? Okay, that's good. Then, can we stand, ma'am? Okay. So you can finish urinating in the toilet. So if the bladder is not empty, urine may accumulate and cause kidney pressure. So the pressure may cause renal failure, which can cause a severe damage and result in irreversible kidney damage. Okay? You can wait, sir. Wait, ma'am, I'm going to get the paper. Okay. Okay, so after letting the client finish urinating in the toilet, so I am going to place the specimen container into the midstream of the urine and collect the specimen, taking care not to touch the container to the perineum or to the penis or the vagina. So this is to avoid contaminating the interior of the specimen container and the specimen itself. Then I am going to cap the container tightly and avoid touching the inside of it and just touching the outside of the container or the cup. So this is to avoid contamination and spilling of the specimen. Okay, so now I am going to attach the specimen label, not the lid. Okay. Okay. So this is to prevent the errors in diagnosis and therapy. Okay. There, it's good to go now. Then I am going to remove and discard the gloves. So this is to prevent the spread of microorganisms. So since I am wearing PPE, so I am going to remove first the glove and throw it on the proper receptacle. Then I am going to remove my face shield, then the face mask. Then I am going to apply alcohol or wash my hands or apply hand hygiene. And then I am going to remove the laboratory gown. Okay. I am going to slide it, then throw it in a proper receptacle. Then I am going again to wash my hands. So this is to prevent the spread of microorganisms. Then I'm going to send immediately the specimen to the laboratory. Okay. So bacterial cultures must be started immediately before any contaminating organisms can grow. So multiply and produce false result. Then I am going to document the relevant data. So this is for legal purposes and for future references. Okay. And we have to remember that what is not written is not done. Thank you for listening.